Hello, everybody. Welcome. Justin Burgess here. Today, I have Dean Jargo with Fair Market Health on the line today. Before we get into our conversation, I wanted to just have the conversation about why I brought Dean to the table. And I'll start with I've been in the employee benefits industry for close to 10 years. And I realized about 2 years ago that what I was doing for the first eight is not what I want to be doing for the next 10, 20, or 30 years. I realized that the model or strategy that we were talking about is not a long-term strategy that I want to continue with. And for me to grow my business, I have to lead with transparency and advocacy. And that's the main thing that we're going to be talking about today. So, Dean, give us a little bit of background about yourself, your CFO background, and also Fair Market Health.
Yeah, happily. So thanks for having me, Justin. I spent 30 years of my career working in finance, most of those in CFO roles at companies of all sizes, mostly very big companies, billion dollar companies. I spent a little time running an accounting group, a little time doing mergers and acquisitions work, a little time actually running a risk management part of our business, which I had no prior experience in, so I had to learn that quickly. But overall, yeah, working in finance and working in CFO roles.
That's interesting. Well, before we get into Fair Market Health, let's talk about your background as a CFO. Before we went live, we kind of were discussing, how most organizations benefits are controlled by HR, and some organizations they leave it up to the CFO or they mix it in between various roles. But talk about your experience in the past of, you mentioned that you didn't have much visibility into the health plan because you let your HR directors run it, which was a totally fine move. But as what should CFOs be doing now if this is a situation where it's not under their belt?
Yeah, yeah. I mean, I've posted a few things on LinkedIn talking about this exact thing, and it all most of those posts start with, "Hey, here's the mistake I made," and the mistake I made as a CFO was I didn't get involved in the health benefits part of our business because of what you said, Justin. Health benefits for all the businesses I worked at, they that reported into the HR organization, and in all the organizations I worked at, HR was separate from CFO, meaning it didn't report in or through the CFO organization. So HR was a separate part of the org, and benefits was part of HR. And because of that, I never poked into the benefits space, and I didn't ask questions about it. I let HR kind of run with it. And there's a few mistakes with that. Number one, as a CFO stands for Chief Financial Officer. Officer means you're an officer of the company, which also means you have a fiduciary duty to everything that happens in the company. And as a CFO, Chief Financial Officer, it means you have purview over all the finances of the company. And that means literally every dollar that flows through the organization, which of course means it includes the benefits space. So again, the mistake I made, and that I'm kind of preaching to every CFO I can talk to today, is hey, if you're not involved in the benefits part of your business, get involved. It is a huge line item, an expense category on your P&L, which most CFOs already know that. But what they don't know, and hopefully today's discussion will shed some light on that, there's huge opportunity in this space, because there's this accepted idea that, oh, it's health benefits, there's nothing you can do about it, which is why a lot of people
Claims are
just
the claims.
go focus on claims are claims. There's nothing you can do about it. It's an absolute and complete lie and fallacy. There's a ton you can do with that. In fact, the argument I make to a lot of CFOs who are working on, projects to improve the profitability of their business, I challenge CFOs all the time to find a part of their business that has more potential profit opportunity, meaning savings opportunity, and more ROI than the benefits line. They're all working to grow revenue and cut costs in other parts of their business, but they're stepping over this huge opportunity called health benefits. And the important thing I'll say quickly is, not only is it a big opportunity to drive savings for the business, but a lot of the way you do it is actually improve the benefits for your plan members. You know, a lot of people have this idea that it's a zero sum game, that if I, in order to save as a company, I have to slash and cut benefits for our employees and their dependents. That's actually not true. It's this wonderful world where a lot of the way you drive savings is actually by enhancing the benefits, and we can get into some of the ways to do that. But there's a lot of strategies that again ultimately make it better for your employees, which obviously help with recruiting and retention, but also drive savings for the business.
That's interesting. So my question to CFOs would be like, do you know your top three expense items in your business, like your supply chain, like what it costs you to run a business, your manufacturers, if you're a paper supplier, what does it cost you to get X?
Yeah.
Flip that question on to healthcare. Do you know your top three suppliers in healthcare? No, you don't.
Yeah.
So
Yeah.
well, let's go in the background of fair market health. Just discuss what you guys do. How do y'all help employers?
Yeah, the easiest way to describe what we do is to think of us a little bit like an Amazon, but for healthcare services. And the reason I use Amazon is everybody's familiar with Amazon. And really all Amazon is a two-sided marketplace that brings together buyers and sellers. And, you know, for Amazon, it's kind of everything under the sun, except for the most part, healthcare services. So we're doing effectively the same thing, connecting buyers and sellers of healthcare services. Uh, but in the healthcare space, the seller of healthcare services are hospitals, doctors, physical therapists, all the people that provide all the healthcare services that people are, uh, you know, accustomed to consuming. And then on the buy side, our customers are self-insured employers, right? Self-insured employers traditionally buy their healthcare services using an insurance network, an insurance provider, a United, Aetna, Cigna, Blue Cross Blue Shield. They go to those organizations in order to acquire or access healthcare services for their employees and plan members. And so what we've done is we've kind of, I don't want to say cut out, but we've gone a more direct route where we allow self-insured employers to interact more directly with the sellers of the services. And the reason you would do that as a purchaser of healthcare services, as a self-insured employer, is everything is less expensive when you buy direct. I mean, we're all accustomed to, you know, going to the Sam's Clubs and the Costco's, right? There's more of a direct relationship between the consumer and the seller of goods, and ours is a little bit more of that kind of model where we put the providers and the buyers more directly in contact with each other, and when you do that, the costs of services are significantly reduced.
Yeah, and a good example is
Some
like,
people call it direct contracting. We call it, I prefer to call it direct purchasing. You're direct purchasing your healthcare services.
yeah, when you look at the guy that does 100 knee surgeries a month, or the guy that does 10 a month, like the guy that's purchasing supplies for 100 is of course going to get his cost down versus the guy that does 10 per month. So
Exactly.
the benefit of you guys is y'all are making that easy for me as the employee that I have to get a knee surgery. How do I know what things are going to cost? And you know, I have a
Yep.
$4,000 deductible. I don't really understand it, but I want to go to someone that can tell me, hey, these are your options. This is based on your zip code. This is where you can go, and you know,
Yep.
you can go down the street for $600 or whatever the number is.
Yep. And that's how we buy everything else in our lives, right? That's how we shop for literally everything else. We know the we know the price up front. We are able to judge quality on all the ways that we judge quality, and that's how you calculate value, right? Is what's the cost relative to the quality or convenience of the service. And for some reason in healthcare, we still live in this insurance centric world where we know none of that. We don't know what the quality is. We don't know what the price is in advance. We find out all of those things after the fact.
Yes,
And
after.
again, one of the things we strive to do at Fair Market Health is we try to bring all of that forward to the front of the decision, purchase and decision making.
Quality is an interesting topic because you're right. Everything we buy, if we go to a restaurant or we go see a movie or anything or schools, like you're looking at feedback from customers or some type of something that says like, oh, we had a good experience here. In healthcare, you go to your primary care doctor, you need this, they refer you to the specialist that's embedded in their hospital system because their boss has told them they have to do that. And you don't know if
Yeah.
that's a quality doctor. Now, some doctors are very open and honest. Thankfully, I have one that's very transparent in his referrals, but some are
Yep.
governed by the entities that they work for. I think that's why you're seeing most doctors
Yep.
go to a DPC model or no insurance because they don't want to deal with the bureaucracy of insurance or big corporate telling them what to
Exactly.
do and how to manage their patients. Well, let's get to the first question real quick. So, given your partnerships with a diverse range of healthcare providers, including independent physicians and large hospitals, how do you ensure all these relationships stay mutually beneficial over time?
Yeah. One of the things that is kind of an obvious tell in that regard is do the providers that we work with, doctors, hospital systems, PTs, mental health therapists, etc., do they continue to use and stay on our platform, right? Because if they didn't like what we were doing, then they would be leaving. And then the same thing on the employer side, right? If the employers weren't getting value from the service that we were providing, then because one of the things that we do, and I'm very passionate about this, is I don't sign people up for long-term contracts, either on the provider side or on the employer side. I always say, look, if we're not delivering value to you, I don't want you to feel stuck or forced into doing business with us. So all of our contracts have very short and easy outs. It's a 30, give me a 30-day notice and you're free to leave. But what we have discovered is they don't leave. They don't want to leave because once they've experienced doing healthcare the way we've designed it at Fair Market Health directly, both on the provider side and on the self-insured employer side, which obviously is the patients as well, the employees who are actually using it, that they love it. So we track, we do customer surveys all the time. It's a 5-star rating system. We track all that feedback. We consistently get 4.8 out of 5 stars. So we track feedback. We react to that feedback. If there's some improvements we need to make, of course we want to make those. But really, turnover is kind of the thing that really is the tell of whether people are getting value from what you're doing. And every year, people just come back, over and over again because they like the experience.
Because the benefit for the providers is they're typically getting paid next day, correct? So
They
they're
they
not.
get paid within, yeah, exactly. I tell them 1 to 2 days payment. They don't have to jump through all the traditional insurance hoops of coding and billing and collections and all the hassles that they have to deal with to be paid. Typically, weeks and months later, we don't make them jump through any of those hoops. And the other thing is they get to decide their price. We don't, strictly speaking, force a price on them, but we do make sure that we are getting the best price that they offer because we pay them quickly and without hassles. That's the trade-off. You give us a great price that we can pass on to our employers and their employees, and we will agree to pay you quickly and without hassle.
And we've been having a lot of issues with the office managers and the front desk people. They get all like they see a certain logo, like, oh, like you're one of these people, and you know they just say it like, oh, your insurance is bad, and I'm like, okay, is it just because you had a bad experience with how they handled one specific claim? You know, every insurance
Yeah.
carrier, self-funded plan, or TPA has a good and bad days, but at the end of the day, that billing person she's got a list of things and she wants to check one off. And if you can say, okay, Mr. Smith, your surgery's for tomorrow and your insurance already paid, like you're good. Like you're not on
Yep.
my
Yep.
stress list. I mean, I know when we had our baby and my wife was going through stuff, like they're hounding you for your deductible like 3, 4 months before the delivery, which is crazy.
Yep.
It's like, can I enjoy the moment before before I hand you
Yeah.
over
Right.
$4,000? Well, let's talk
Right.
about the employee
Well,
experience
well,
because, oh, sorry, go ahead.
well, I was just going to say quickly, Justin, one of the other things that we've seen is that providers, after they've kind of understood the value of being paid directly from a self-insured employer, through fair market health, what they start doing is they start telling their schedulers, hey, put these patients at the top of my schedule. So the patients start getting priority treatment because the doctor knows they're going to be paid quickly and without hassle, which is a great kind of intangible benefit that flows back to these self-insured employers and their employees. They start getting priority treatment, which is what you want for your employees. You want them to get that priority treatment.
Yeah, so let's talk about the employee experience. So, how do you ensure that the employee experience is seamless, especially when they need to navigate the system for the first time? What does the role of HR have to play with it? A lot of my clients, HR's tapped right now. There's no room for,
Yeah,
hey, call me
yeah,
and give me help. And a lot of the questions come back on us as the broker, which is totally fine. That's what we signed up for. But how do you make
yeah.
that experience for employees where it's easy without a broker or an HR support?
Yeah, exactly. Well, so one of the big things that we've invested heavily in is an online marketplace. And at this point, who hasn't purchased goods or services online, right? We all book our airline tickets online. We book our rental cars online. We, rent houses on vacation online. We goods and services through Amazon online. We do everything online. So we're all accustomed to buying things through online shopping channels. So we have built our experience at Fair Market Health exactly the same way. It looks and feels very similar to what a customer would experience buying goods and services in any other part of their life, right? It's a add this service to your cart, a checkout process, very simple, very easy. And then on top of that, we have live customer support, because one of the frustrations, that we've all experienced is you have a question about something and then you get trapped into some customer service nightmare where you can't talk to a live person. You're on a phone tree trying to get to a live agent to find or get someone to help you with a question you might have. Because I hate that, I don't want to force that onto anybody else. So we have live agents who are available. You can call them on the phone, you can email them, or you can just web chat them, live on the site, which is frankly how a lot of people do it. They just get a real-time response to their question. I watch our chat responses. They are 20-second responses from the time you type in your question and hit enter. Within 20 seconds, you're going to get a reply from a real live person and can have a real live conversation. And that's our commitment to make sure that patients aren't, or plan members aren't ending up either in your office or on your phone, Justin, or on the HR person's.
And this probably is my question.